Hi, my name is Julia, and I am on the Psychiatric Mental Health Nurse Practitioner track. I will be presenting my pocket guide blog for NU629 today. So I printed out my pocket guide and I put it in a folder. I think this will be really easy for me to bring to clinical, carry around. I can easily put it in a bag. So I printed out my pocket guide blog. I stapled it together. And like I said, I think this will be really easy for me to have easy access to. So for my first blog, I have 8 total pertaining to each week. I did levels of prevention and mental health. So I have the definition here for each level of prevention: primordial, primary, secondary, and tertiary. And then I have an example for each one as well. I also have a really good picture here that has some examples on this side. For my next blog post, I chose to include several screening tools that are commonly used in the field of mental health. So these are something that I'm going to be using often in terms of initially assessing my patient and reassessing to gauge their clinical response. So the first one I chose was anxiety, which is the GAD-7, depression, which is PHQ-9, bipolar is the mood disorder questionnaire, and then alcohol use, there's a couple different ones right here. Substance use is the DAST-10. ADHD is the ASRS, and this is the adult version. And then for schizophrenia, I have the brief psychiatric rating scale. So these are several tools that I can quickly reference when I am engaging with a patient, so I think this will be really helpful. For my next post, I discussed postpartum mental health. I included some symptoms for postpartum depression and also the treatment of postpartum depression. And then I included symptoms of postpartum psychosis and the treatment of postpartum psychosis as well. For my next post, I chose to discuss premenstrual dysphoric disorder. I think this is something that can be sometimes difficult to treat, so I think having this will be very helpful. I included, there's 4 criteria, criteria A, B, C, D, and with D meeting the patient meets all of the above criteria for formal diagnosis of premenstrual dysphoric disorder. And then here I have some risk factors that women may experience that cause them to be prone to premenstrual dysphoric disorder, some treatment here, and then common differential diagnoses. I also included for this post premenstrual symptom screening. It's another tool that can be utilized when forming a diagnosis for a patient. For my next blog post, I chose to discuss healthy lifestyles and mental health, because oftentimes being a psychiatric nurse practitioner, it's not just handing out medications. So a lot of it comes from lifestyle choices. So I think this will be really good to reference when discussing other options for my patients. So reducing stress, improving self-confidence. This is the benefits of exercise on mental health. Increasing relaxation, alleviating anxiety, and preventing cognitive decline. These are just a few examples of why people should incorporate exercise into their daily lifestyle. And then here are some foods that are great for mental health as well. So there's dark chocolate, eggs, fermented dairy, meat, leafy greens, nuts, beans, and seeds, colorful fruits and vegetables, and seafood. And then in blue under here, there are suggested serving sizes. For my next blog post, I chose to discuss the social determinants of mental health in older adults. Oftentimes, older adults face much more risk factors for experiencing mental health deficits. So these are some things to look out for. Stigma and ageism, which is the presence of stereotypes, discrimination, and prejudice towards individuals due to their age. Lack of geri-psych providers. Loneliness, wisdom, resilience, meaning in life, and community engagement. For my next post, I chose to discuss youth mental health. So here is a chart of interventions that can be implemented based on the developmental stage of a child's life to prevent mental illness. And down here, these are just some signs of when a child might need mental health evaluation. Up here is signs of a young child needing mental health evaluation, and this is signs an older child would need mental health evaluation. And then lastly, I chose to include some charts of common adverse effects of medications, of psychiatric medications. These medications have a lot of side effects, and oftentimes we are choosing a medication for a patient based on the side effect profile. For example, if someone is having insomnia because of their anxiety or depression, you are going to want to choose medication that is more sedative. So having these side effects right here is going to be really helpful. For this chart, it's antidepressants. The next one I chose were antipsychotics in their side effects. And then the last one I chose were benzodiazepines. And this is just immediate and long-term consequences of using benzos. So I think overall this is going to be extremely helpful for me to have in clinical and even afterwards. I think this will be a really good resource for me in my coming years. Thank you.